You are heard this term, like many of you might not have heard this term, and it's okay. It's called an advanced technology, both in neurology and psychiatry as an intersection. Um, Before I get into rTMS per se, I want to really bring up this concept of psychiatry being previously assumed as predominantly stress-induced disorder, and now it has over time taken over or has been clearly established as a neurobiological disorder. That's how the role of rTMS comes in, because the repetitive transcranial magnetic stimulation is known to alter the aberrant pathways in the brain, which are being proven to be responsible for psychiatric disorders. Okay. So the outline of my presentation will be, I'll be setting the context of why we are talking about rTMS, and giving enough biological evidence as why psychiatric disorders are neurobiological disorders, and defining what is neuromodulation, because rTMS is one of the neuromodulation technique, and a brief on how does rTMS work and what are the indications in both psychiatry and neurology. And if there are any questions, you can always interrupt me in between, or at the end of the session we could take it up. So even I carried the same myth as psychiatry is something which is stress induced, and people might get addicted to drugs. All of it has been debunked, and it is proven that it's a neurobiological disorder. And with the evolving classificatory system, mood disorders and the psychotic disorders dichotomy that was always there has been disproved, and we always know there is enough genetic basis and equal amount of environmental factors, that is stress, conflict, all of it add up and create the psychiatric disorders. So what we understand currently is all psychiatric disorders are network based disorders. That is, all psychiatric symptoms have a base in the brain. That's how we are trying to alter the brain status by using all this neuromodulation techniques. Okay, so I'll take an example of addiction disorders. All of you might get, like probably interns or the PGs who would see an alcoholic patient walking into their emergency or in the wards, you would feel very bad or angry, like why is this fellow drinking and coming every now and then. But we, like with my training, I've understood it's not the problem of the system or the availability of alcohol. It's not the problem of the society. It's the problem of the brain that is always there. So there are enough number of studies which says addiction is a neurobiological problem, where they are trying to point out that basal ganglia, the extended amygdala, the prefrontal cortex, right from the cortical to subcortical structures, way down, all of these neural networks are aberrant or pathological in addiction. So that's how these neuromodulation techniques have been proven to be of use, which can alter these brain status. Okay, so this is a picture depicting like how during intoxication phase different brain structures are affected, and during the withdrawal phase and in the preoccupation, whenever they relapse, what are the brain structures that are getting affected. It's the reward pathway ultimately that is getting hijacked, and people get back into alcohol though they are trying to remain abstinent. So addiction has a lot of correlate with depression. So the same network system that is involved in addiction is also involved in depression. So that way, all these common mood disorders, addiction disorders are modulatable disorders through neuromodulation techniques. So it's the same, like different brain regions which are affected in depression: the orbitofrontal amygdala, hypothalamus, the ventral tegmental area, all of it are part of reward pathway. Okay, so to summarize, the psychiatric disorders are always neurobiological disorders triggered and maintained by psychological and social factors with good enough amount of genetic and epigenetic loading. So this proves or sets the context for today's presentation, where we feel there's a need, it's a need for the hour for us to learn that there are other techniques to treat, not just counseling or therapy or medications which are just acting on dopamine or serotonin. So we are more advanced, and right from the time 1985, when Barker discovered this magnetic stimulation techniques, it has been worked on, and multiple RCTs have been done, and currently rTMS is involved in the guidelines, it's recommended in the guidelines for a range of psychiatric disorders, which I'll try to discuss. So, defining what is neuromodulation. When you look at what is neuromodulation, it is nothing but you are altering the nerve activity either by a chemical or an electrical or magnetic methods, where any neurological sites will respond to it. Okay, so these are the stimulus, either chemical or electrical stimulus. You will alter the nerve activity. So that is called the neuromodulation. So what is brain stimulation? In neuromodulation, it can be involving any part. It can be any nerve, that is brain, peripheral nerve, or spinal cord. Okay, but in brain stimulation, it is per se saying from the term, it's a brain area, some brain cortical area that you will stimulate. Okay, so here either electric or magnetic energy is used over the brain area, either to investigate or to treat, where you will try to either inhibit a brain area which is excited or excite a brain area which is inhibited, which is hypothesized as a pathology in psychiatric disorders or many of the neurological disorders too. Are you able to get, are you people able to follow? It's some way of energy, either magnetic or electric or a chemical, you will try to apply over the brain regions so that it responds. If it is working slow, it will be activated. If it is working fast, it will be slowed down. Okay. So these are the range of neuromodulation techniques that we have, like a huge list. But the technique that we are talking about is the repetitive transcranial magnetic stimulation, and it is one of the safest technology. And the good news is that you have the technology in your department, and I congratulate the department for the same. It's a very advanced technology. It costs lakhs of rupees, but it's a technology that is available, which is the safest treatment available for depression, OCD, schizophrenia, without much side effects and without much contraindications. So it is one of the best techniques, I would say, in psychiatry. So it comes under the non-invasive transcranial neuromodulation. Means to say you are applying the magnetic pulses across the cranium. Means you are not opening up the skull or the brain area, unlike deep brain stimulation where you will put the electrodes opening the skull. But in transcranial magnetic stimulation, you can deliver the pulses across the skull bone. Okay, so it is non-invasive that way, and it is transcranial. It is, the pulses are simply passing across the skull bone. Okay, so there are other techniques which are transcranial electrical or direct current stimulation, which is also of similar mechanism. Okay, so this is what is the machine you have, exactly the machine that your institute has, where there is a machine which stimulates the brain through the help of a coil. This coil generates the magnetic pulses, which when placed over the skull will induce the electrical activity in the brain area. So this is how you place it. This is the magnetic coil. The coil the same one that is here. It's a different figure of 8 coil with a little indentation, where you place over the brain area that you want to stimulate or inhibit. Okay, so and once you switch on the machine, there are ways to give these pulses. Magnetic pulses means the brain is able to sense the message from the magnetic pulses only when you give in a certain protocol. It should be given in a repetitive fashion as biphasic pulses. There are ways to do it. I'm not dwelling into the techniques of it because it's not so relevant to you people, but I'm trying to just ignite an interest in you that this technique exists and it's a safest method available for depression. Okay, so when you look at like how does this work, like why would a magnetic pulse cause any kind of a change within the brain, is the basic question any of you will have. So this is what happens, and I can show you a video how it happens. So when you deliver a magnetic pulse over the brain area, if you take a motor area or the motor cortex, that crosses across, that generates a kind of electric current within that cortical structure, and that passes across the like the cortical decussation and creates a motor twitch. That is a visible evidence of magnetic pulse causing some effect in the brain. Okay, so when you give one single pulse, it will be just a twitch. But when you are giving it in a repetitive fashion, what Dr. Prasad was trying to tell, neuroplasticity or long-term potentiation or long-term depression. So if you give it multiple times repetitively as multiple bunch of pulses, it affects the synaptic junction and causes something called plasticity. So whatever is abnormal network in the brain in psychiatric disorder will get modulated, and that remodulates to become a normal brain network. That is what is expected for neuromodulation to cause. So I'm not sure if this works. I'll try. If not, I'll open in the Google itself. The thing that I was telling, how a magnetic pulse can induce a twitch. This guy is trying to demonstrate that. So when they place over that coil over the motor cortex, you can't place it anywhere over the brain and expect a motor twitch. You'll have to place it exactly over the motor cortex and you see a twitch there. So when you give a pulse through the coil, you'll get a twitch there. Okay. So that is one of the techniques where we try to understand what is the dose of magnetic pulse that I have to give. Okay. And the next video, there's another way, like there are enough evidence which says magnetic pulses delivered over the speech area can arrest the speech. This was one of the initial experiments done by Barker on epilepsy patients, where he saw when the magnetic pulses were delivered over the speech area, there was speech arrest. This is the twitch that is elicited and observed through the EMG method. So this is one of the advanced technology where they're trying to use neuronavigation, where the brain areas are mapped, and when he's trying to talk, I don't know if the volume.
Sound is there. You can see it on the screen. There. Initial one.
Let's see once. No, I think it's not taking. So he's trying to read out the pictures that he's been shown. At some point when the pulse is given, he's unable to read out that word. So it can cause speech error. So that way there's enough obvious evidence that the magnetic pulses are sensed by the brain, and there's something happening within the cortical regions that magnetic pulses have been given, right? So as I said, like the repetitively when you give it, that causes effect in the synaptic regions where it will try to change the aberrant pathways. Okay, so these are all the list of indications where rTMS is used. The ones which FDA has approved is for depression and OCD, to some extent some symptoms in schizophrenia, and cognitive impairment in dementia, substance use disorders, post-traumatic stress disorders, and a range of neurological disorders also, but the level of evidence is not that great as for psychiatric disorders. But one of the good evidence is definitely available for stroke rehabilitation. There are other motor symptoms of Parkinson's, dystonia, epilepsy patients. So I think there are plans to take up some research studies in pain conditions like fibromyalgia also in the institute. So these are the range of neurological conditions and psychiatric conditions where TMS is definitely is one of the best choice without side effects. So as I said, like this technique, though advanced, has already gotten into the guidelines, and this guideline was published in 2020. And I will just list out the same set of indications that they are trying to recommend. Among the list of neurological conditions or the like other condition like tinnitus, there's only probable evidence, means level B evidence, where there's something called high frequency rTMS, which I'm not getting into the details of it, of use at different brain regions. When we have utilized those rTMS, it has definitely helped. And there are more researches that are happening. And for psychiatric disorders also, as I said, FDA approval, and the strongest evidence is for depression, where it's definite evidence and level A evidence. There are other list of conditions that I have already narrated. So some of the neurologists and neurosurgeons, if at all they're in the crowd, there's something called neuronavigated rTMS, where post-op prognostication of patients can also be an application for rTMS, where they will try to mark the brain area which can be excluded while wanting to remove the tumor mass, or also to predict if there are already existing neurological deficits. Then the prognosis can be well educated to the patients and the family. Even though an intervention is given, whether how much recovery is possible is something that they can do with the help of neuronavigated rTMS too. So this is like where the brain area has some kind of external response, like motor or language or calculation. Those can be figured out with the help of rTMS pulses. So getting into like how this is basic physics, as how rTMS has led to this kind of a mechanistic or therapeutic change. We know from Faraday's law that magnetic pulses, because of the electromagnetic induction, can cause, like perpendicular to the magnetic pulses, there is electrical current generated. So that electric current is something that is stimulating the brain area, particularly the interneurons, and that interneurons peaks across, and it causes a volleys of current which can cause long-term changes in the synaptic junction. That is what is the basics behind like the physics helping the technology and the medicine or the science. So repeating the same as what I have told, it's the magnetic field which will cause ionic changes at the AMPA or the NMDA receptors, which are involved in neuroplasticity, and it causes a downstream changes in the network or the circuitry that I was telling about, which is involved in many of the psychiatric disorders. And beyond the time of stimulation, though I am giving a stimulation for 2 minutes or 3 minutes during the session, it causes long-term effects beyond the time that is expected, and that leads to therapeutic effect is what is understood. So it's proven that it can cause the long-term potentiation, depression, synaptic plasticity. There are enough markers to say when stimulation are given, the BDNF levels or the brain-derived neurotropic factor, which are markers in improvement, is also been established, and some neurotransmitter changes, and the oscillations like the alpha, gamma, theta waves that we talk about in brain waves, those also modulate, is what has been proven to different research studies. Yeah, so this ends my presentation. If there are any